We're going to now take up House File 3928, which is Representative Brand's bill, but Representative Vang is going to begin the presentation. The chair moves that House File 3928 be recommended for re-referral to the Committee on Government Operations. Representative Vang, welcome to the committee. We do have an author's amendment in our folders, so the chair will move the A1 author's amendment. All in favor? Aye. Opposed? The A1 amendment is adopted. Representative Vang, please present your bill.
Thank you, Madam Chair. I'm State Representative Samantha Vane. I'm here to testify on behalf of Representative Brands, who's the chief author of this bill, House File 3928. He'll be here shortly, so once he's here, I'll also step back. I also have another bill hearing shortly, too. This bill, House File 3928, modifies membership of the Health Department eHealth Advisory Committee and eliminates its expiration date, modifies membership of the Rural Health Advisory Committee, and establishes an advisory council on water supply systems and wastewater treatment facilities, and a Health Equity Advisory and Leadership Council. And so I also have testifiers here with me today to who can describe further on these types of committees, and if there's any questions.
That's our first testifier, Joko Farah, here. Yes, please come to the testifiers table. Welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you, Madam Chair and committee. My name is Dr. Joko Farah. I am the Chief Information Officer for People Center and the co-chair of the Health Equity Advisory Leadership Council. The HEAL was modeled, just to give you guys context, the HEAL was modeled after DHS's Cultural and Ethnic Communities Leadership Council and was created in 2017 under Commissioner Ellinger. In that time, we've had some powerful movements and we've created a community-led advisory council consulting with commissioner and agency leadership on how to embed equity into the agency's policies, programs, and processes. Our diverse council represents rural Minnesotans, Minnesotans with disabilities, communities of color, indigenous folks, tribal government, LGBTQ Minnesotans, immigrants, refugees, and more. As an external advisory body, we're able to hold MDH accountable on moving the dial and the needle to address health disparities in ways that the community has not been able to do before. Examples of what we've accomplished in this short time: our council members have dedicated over 750 volunteer hours to participate in these council meetings and conversations with MDH. We've advised MDH on their last strategic plan and the formation of the new strategic plan that's ongoing right now. We've reviewed MDH's grant proposals to ensure that they have an equity lens and are reaching communities that need it the most. We've consulted on the Minnesota statewide quality report and measurement systems and provided recommendations using an equity lens. We've issued a memo to Commissioner Malcolm and presented that memo that has had support from over 25 institutions across Minnesota. The memo highlights our top priorities for the agency, including community engagement, systems change, and data practices. We are now overseeing the implementation of those recommendations with agency leadership. None of this would have been possible without the existence of HEAL. The statute would solidify our structure and ensure that the agency implements the changes necessary to close gaps and disparities across the state. Thank you.
Thank you for your testimony and for your good work.
Thank you.
Is there anyone else in the audience who wishes to testify on House File 3928? Is there discussion from the committee? Representative Edelson.
Thank you, Madam Chair. So I just want a clarification. The Health Equity Advisory Council and Leadership, it already exists, right?
It does.
It does. Okay, and so we're just adding a member onto that council, correct?
What we're asking for is, although I'd like to defer to MDH for the for concrete information. What we're asking for is permanence. Currently, that statute is in the Eliminating Health Disparities Grant. However, if that health disparities grant goes away or that initiative goes away, the HEAL Council technically goes away as well. So what we're looking for is, we're looking for permanence and no expiration date on the HEAL Council.
Madam Chair.
Representative Edelson.
And so that is looking at the expiration shall remain in existence until health inequities in the state are eliminated. That's the language. We just heard a bill on that, and I was just trying to find that. Oh, so thank you. That answers my question.
Representative Freiberg.
Thank you, Madam Chair. So, yeah, I'm assuming then if it's part of a grant program, maybe it's currently in a session law and this puts a section into a new statute. Is the language the same as it currently exists, or are there any changes?
Dr. Farah.
Yes. I'm going to have.
Phone a friend.
Lisa. A friend. Phoning a friend right now. Yes.
Please state your name for the record.
Hello, I am Lisa Timian, Legislative Director for the Department of Health. To clarify, so the HEAL Council was initially created by the Commissioner. It wasn't by legislative an ask or requirement or request. So this is actually just a way to make sure that whoever the Commissioner is going forward at the Department of Health, that this work can continue.
Welcome, Representative Brand.
Thank you. I still haven't mastered being two places at once. Still
It's-
trying.
It's challenging. Further discussion? There being no further discussion, the chair renews her motion that House File 3928 be recommended for re-referral to the Committee on Government Operations. Thank you. As amended to the Committee on Government Operations. If all in favor, say aye.
Aye.
All opposed? The motion prevails. House File 3928 is recommended for re-referral to the Committee on Government Operations.
Thank you. Thank you.